Baron Cohen explains that social and cultural differences between men and women do not explain why the female brain is better at empathizing while the male brain is better at systematizing. The organizational hypothesis of gender differentiation suggests that psychological sex-based differences originate from the prenatal sex experiences involving androgen-related brain masculinization. The brain masculinization process occurs in the second trimester of gestation, where male brains are altered in structure and function to create masculinized play preferences, cognitive abilities, and personalities. Costa and colleagues argue that sex-based variations in androgen levels in early development affect aggression, activities, and interests. Normal levels of prenatal androgen exposure differently affect the psychology of boys and girls. Hines explains that brain regions with appropriate testosterone, which is the most biologically potent androgen, or related metabolite receptors, affect the death and survival of cells, neurochemical characterization, and neural connectivity. In other words, testosterone exposure prenatally affects brain development and subsequently influences infant behavior. Alexander and Wilcox note that higher prenatal androgens result in sex-specific changes in the central nervous system's ultrastructure through dendritic branching, cell migration, cell death, and cell proliferation. Testosterone receptors are found in various brain regions such as the cerebral cortex, the medial amygdaloid nucleus, and the hypothalamic nuclei. Thus, the hormonal changes in developing central nervous systems affect volumes of the hypothalamus, amygdala, and hippocampus. Manipulating mammalian testosterone levels influences the development of the listed brain areas' neurochemical usage, anatomical connections, and cell survival patterns. The brain regions listed before influence memory, learning, aggression, and sexual behavior. Hines argues that human fetuses show dramatic sex differences in testosterone levels between 8 and 24 weeks of gestation. Particularly, Udry, Morris, and Kovenik argue that defeminization and masculinization happen between 8 and 20 weeks of gestation, otherwise the female architecture persists. Cohen-Benderhan and colleagues maintain that sexual differentiation of the human reproductive system depends on the amounts of androgen produced during the critical stages of prenatal development, that is, 7 to 8 weeks, when the testes develop and begin secreting testosterone. The authors suggest, and I quote, "With higher levels of testosterone, the genitalia become the penis, scrotum, and urogenital sinus, whereas lower absent testosterone results in the development of the clitoris, labia majora, and separate vaginal and urethral canals. Intermediate levels of testosterone result in ambiguous genitalia, for example an enlarged clitoris with fused labia, and a small penis." Sex hormones also affect the development of the internal reproductive structures. Dihydrotestosterone and other testosterone metabolites account for physical differentiation of the external genitalia and variations in learning abilities. The individual aspects affected by testosterone exposure include sexual orientation, gender identity, play behavior such as toy preferences, and observable differences between men and women. Alexander, Wilcox, and Farmer suggests that prenatal androgen action informs the preference of balls to dolls. Girls have visual preference for dolls because of their human attributes, while boys show preferences for mechanical machines than faces. Subsequently, girls respond better to emotions, are more empathetic, cry more, are more joyous at their mother's appearance, are more responsive to maternal vocalizations, are distressed by still maternal faces than boys. These gender variations become reversed at 6 months of age. Some of the behavioral effects of testosterone are more pronounced, such as sex-typical play, while others are not, including sexual orientation. The playmate differences are noted in rodents and rhesus monkeys as documented by Cohen-Benderhan and colleagues. In rodents, testosterone exposure manifests in behaviors such as adult sexuality, juvenile rough play, aggression, and maze performance. In rhesus monkeys, testosterone exposure influences rough play, grooming, and learning abilities. In humans, exposure to testosterone makes boys worse at inhibitory responses, sensitivity to environmental changes, fearfulness, cuddliness, and inactivity. Hines argues that normal-range testosterone affects individuals within each sex differently, with some being more sex-typical than others. Exposing mothers to testosterone during pregnancy raises the subsequent levels of male typical behavior for the unborn child. Aoyu and colleagues explain that in mammals, especially humans, non-humans, and rodents, sex differences in juvenile play behavior arise partly from androgen exposure. The authors argue that fetal testosterone from the amniotic fluid is positively associated with male typical scores, especially play in boys. The genetic disorder congenital adrenal hyperplasia or CAH, which is an autosomal recessive disorder associated with adrenal androgen levels due to a deficiency in enzyme 21-hydroxylase, 21-OH, exposes girls to higher than normal androgen levels, a phenomenon that manifests in girls exhibiting male typical play, including toy, playmate, and activity differences. These male-typical behaviors observed in girls with CAH are more prominent when compared with other girls, but less when compared with boys. Girls with CAH do not show playmate preferences as others do with those of their sex, while adult women are not exactly heterosexual as they could be homosexual or bisexual. The effect of CAH is smaller in gender identity and sexual orientation when compared to sex-typed behaviors. Girls with CAH are born with either partial or complete virilization of external genitalia, thereby making it easier to diagnose at birth. Alexander and Wilcox assert, and I quote, "Androgen-dependent virilization of external genitalia in human infants supports gender labels, social categories that activate a lifelong process of gender socialization that extends from gender-typed toys for newborns to the daily modeling and reinforcement of gender-appropriate behavior." Girls exhibit higher length-to-weight ratios, less prominent chins, and anteriorly narrower dental arcade than boys. These biological differences affect socialization, with adults perceiving girls as smaller, softer, and finer-featured while boys are handled more roughly. CAH in girls manifests in differences in sexuality, handedness, cognitive abilities, personalities, and activity interests. Girls with CAH are subsequently treated to normalize hormonal levels, thereby providing evidence of masculinization resulting from prenatal androgen exposure. This treatment involves corticosteroids that regulate hormonal milieu. Boys with CAH have the ability to prenatally adjust testicular androgen, thus avoiding unnecessary elevation. Hines observes that the complete androgen insensitivity syndrome, CAIS, in boys is the equivalent of CAH in girls. The author points out, and I quote, "CAIS is an X-linked disorder in which the cells of XY individuals lack functional androgen receptors, and so cannot respond to the testosterone and other androgenic hormones produced by their gonads, are almost always female typical not only in physical appearance, but also in terms of behavior, including core gender identity, sexual orientation and childhood play behavior. Lack of sufficient androgen exposure or utilization results in the adoption of female-specific psychological developments." Baron-Cohen observes that individuals with androgen insensitivity syndrome are generically and gonadally male, hence producing normal levels of androgen, but genetic defects make them insensitive to the hormones at the cell level. At birth, most infants with androgen insensitivity syndrome look genetically female, but the syndrome is eventually detected at puberty. The fact that the sexual differentiation of the mammalian brain is regulated by gonadal hormones, especially androgens, implies that manipulating the respective hormonal levels prenatally or neonatally permanently changes various regions of the brain and subsequent behaviors. Treating developing rodent females with testosterone and other androgens raises the manifestation of male typical plays, with similar effects being recorded for gender-neutral behaviors. In developing human children, Aoyu and colleagues report that sex differences in toy preferences are reported in children as early as the first year of life, with the magnitude of these differences, including playmate and activity differences, becoming larger as children enter into middle childhood. It is worth noting that the positive relationship between prenatal androgen or testosterone exposure and masculinization is sometimes associated with mothers having high testosterone levels encouraging male typical play in their daughters, thereby developing the relevant behaviors as opposed to differentiation in brain development. This phenomenon is documented by Hines, who suggests that maternal and fetal testosterone present a significant degree of correlation. Thus, maternal testosterone levels affect the adoption of male and female-specific behaviors in adulthood. Noteworthy, high testosterone levels in mothers arise from the administration of pharmacological androgenic progestogens doses that minimize the risk of pregnancy loss. This maternal testosterone could diffuse through the placenta to the fetus. Testosterone measured in amniotic fluid affects psychological characteristics such as vocabulary development and eye contact because the hormone has a relationship with autistic spectrum disorders more commonly among males. Alexander, Wilcox, and Farmer argue that hormones in females are unrelated to visual preferences, while higher androgen in males predicts preference for male-typical stimuli. Alexander and Wilcox explained that in the first 4 to 6 months of life, girls' maturation of visual acuity precedes that of boys. Differences in stereopsis arise from girls' better eye vergence, which negatively correlates with plasma testosterone levels. Hines asserts that 75% of classic autism and 90% of less severe Asperger syndrome are recorded among males. This assertion is based on the fact that amniotic testosterone shows less variability in females compared to males, thereby making effect detection in females more difficult. Also, the behavioral impact of testosterone is more applicable in males than in females, but the relationship between CAH and autism challenges this fact. Testosterone has a greater psychosexual effect in females than in males, as is mostly evidenced by CAH, while eye contact and vocabulary development are affected by amniotic testosterone. Other characteristics, including visuospatial and mathematical abilities that mostly favor boys, are affected by age and type of task. Cohen-Benderhan and colleagues maintain that masculinizing effects of prenatal androgens are mostly noted in certain personality aspects, spatial abilities, and sex-typed interests. Anderson, Wilcox, and Farmer explain that high androgen exposure during brain development accelerates the formation of synapses in the visual cortex, which results in the organization of visual formation pathways that manifest in gender-related perception differences, including color, movement, and form. These differences affect playing styles and spatial processing. According to Alexander and Wilcox, if infants have sex-linked dispositions that represent seeds of later behavior, then a reasonable hypothesis is that male and female infants may differ in temperament, in sensitivity to social stimuli, and in cognitive processes that support the development of the male advantage in spatial ability. The impact of hormones on visual processing is further mediated by heightened hypothalamic pituitary gonadal activation that causes the underlying differences in gender manifestation. Tapp and colleagues explain that gonadal hormones affect neural structure, physical differences, and masculinizing or feminizing differences. Physical differences associated with higher exposure to prenatal androgens contribute to infant growth and inhibit lung development. Men perform better than women in tasks that require mental rotation skills, but these sex differences are more pronounced with age. Hines maintains that testosterone exposure minimally influences mental rotation abilities, even though the abilities show marked sex differences in favor of boys. Moore and Johnson explain that only male infants have the ability to recognize a familiar object from a new perspective, especially a different angle, a feature that requires mental rotation. Also, only male infants can discriminate a habituation object from its mirror image. Males' attention to the mirror image stimulus allow the inference of recognizing the differentiation of a habitual object from a different angle. Alexander and Wilcox argue that event mapping and mental rotation present the greatest sex differences. Longer looking at mirror images evidences mental rotation skills for boys, with 3-month-old boys showing preference for a rotated mirror image. Boys detect inconsistencies in event mapping tasks at an earlier age than girls. This phenomenon holds true even when children are given hints. Boys are more likely to identify the trajectories of mobile occluded objects, thereby being more likely to extract simple structures. Sex differences in object mapping are similar to those linked to object processing tasks, including object reversal. Mental rotation tasks present the largest sex differences, with these and other sex differences being attributed to the effects of gonadal hormones, differences in maturation rates of the brain's hemispheres, and experiences with different tasks and stimuli. Baron Cohen asserts that the right hemisphere is involved in spatial ability, which is facilitated by the underlying systematizing components, while the left hemisphere is concerned with language and communication, hence the ability to empathize. Olson and colleagues argue that testosterone administration to females raises their facial dominance ratings but reduces the accuracy in inferring mental states. Estrogen exposure to men increases emotional reactivity, thereby evidencing the effects of hormones on social, cognitive, and emotional functions. Baron-Cohen suggests that gender differences are also observed in transgender individuals owing to the variations in hormonal levels. Notably, transitioning women are exposed to androgen to masculinize them, while transitioning men are exposed to anti-androgen or estrogen. Transgender males subsequently report higher scores on spatial rotation tests, with the reverse being true for trans women. Men's right side of the brain develops faster than women's, with the opposite being true for women's left side. Maccabee observes that males' functions are lateralized, and as such, functioning is associated with the activation of one hemisphere of the brain, while female functioning is associated with two hemispheres. Performance sex differences in other spatial-related tasks that do not require mental rotation are smaller. Girls perform better in computational abilities, but sex differences do not exist in the relevant tasks. Girls with CAH show enhanced spatial abilities compared to other girls. Cohen-Bendahan and colleagues argue that studies involving monkeys and rodents highlight the complexity of timing effects where variations in androgen sensitivity affect behaviors differently, with some behaviors being masculinized with early exposure and others with late. Early androgen exposure in rhesus monkeys results in masculinized genitals, increased mounting of peers and mother, and less grooming behavior. Late exposure manifests in normal-looking genitals, increased rough play, and mounting peers, but not the mother. Udry, Morris, and Kovenik argue that androgen exposure in the second, and no other, trimester of fetal life, combined with an interaction with adult androgens, masculinizes women's behavior and explains a substantial proportion of the within-sex variance in women's adult gendered behavior. Timing, which determines structure and the appearance of the relevant neurons, is important based on the fact that classic steroid hormones exert influence through the availability of the relevant receptors. Studies on monkeys also shed light on the environmental context of hormonal behavioral variations. For instance, juvenile monkeys' behavioral expressions are influenced by their environments. Cohen-Bendahan and colleagues differentiate organizational and activational effects through the assertion that organizational effects produce irreversible changes to the wiring and sensitivity of neutral brain structures during the early stages of development, while activational effects are associated with hormonal variations that activate neural systems. Organizational hormones alter hormonal sensitivity prior to puberty, since the development stage is characterized by massive physical changes that result in activational variations. Tapp and colleagues note that the organizational and activational hormonal dichotomy could be too simplistic, considering the fact that the organizational effects of androgen are exerted beyond the neonatal period. According to Alexander, Wilcox, and Farmer, the organizing effect of androgen on developing brains greatly contributes to the expression of male-typical behavior. The authors maintain that puberty increases the production of sex steroids, which influences the manifestation of secondary sex characteristics, including breasts in women and facial hair in men. Organizational effects are most important in areas where the brain's hormonal sensitivity peaks, which is between 8 and 24 weeks of gestation. 1 to 5 months after birth is also a sensitive period for male infants where neonatal testosterone impacts genital development. Serum testosterone levels peak at around the first 3 months of life and they drop to prepubertal levels at around 6 months. Alexander and Wilcox posit that the 3 to 6 month increase in postnatal testosterone is fundamental for the development of male genitalia and greater penile growth. Variations of serum testosterone levels in pregnant women presents the likelihood of the relevant hormonal levels among female fetuses being influenced by those of the mother. The postnatal rise of testosterone levels in male genitalia development, the underlying reproductive function, and the breast tissue sensitivity to estradiol and growth in adulthood are all important in sex differentiation. The classic hormone behavior theory suggests that sex-based hormonal sensitivity in the early stages of infancy and the resultant effects on physical development evidences the impact of hormones on the sex differences in behavior. Alexander, Wilcox, and Farmer argue, and I quote, "There is an association between postnatal hormone levels and sex-linked behavior in early infancy. Activation of the hypothalamic pituitary gonadal axis in postnatal life contributes to the development of sex differences in behavior, a possibility suggested by previous evidence of the biologic actions of hormones in prepubertal children and recently observed sex differences in human behavior during the first year of life. The hormone behavior associations, especially in male infants, evidences the impact of androgen on male and female preferred features in toys and the choice of larger social groups in adulthood. Most of neonatal hormonal buildup focuses on testosterone and the subsequent masculinization of infants. Alexander, Wilcox, and Farmer observe that increased testicular production of androgen masculinizes and effeminizes the genitalia, as well as the developing neural system. Cohen-Benderhan and colleagues suggest that ovaries start developing 3 months into gestation, but estradiol is secreted in minimal amounts later on in embryogenesis. Estradiol from the androgynous brain influences some male typical behaviors. All fetuses are exposed to estrogen from the placenta, which accounts for the minimal effects of the hormone. Ovarian progestins are anti-androgens that could also act as androgens. Overall, the presence of one hormone accelerates or inhibits the production of others. Apart from exposure, sensitivity also influences the effects of hormones, hence the differentiation between early and late exposure. Variations in the sensitivity of androgen receptors range from complete insensitivity resulting in feminine differentiation to infertility and minimal undervirilization. Social and behavioral scientists argue against the organizational hypothesis of gender differentiation by suggesting that the hypothesis is both sexist and ideological. However, Udry, Morris, and Kovenik argue that the behavioral variations in human and non-human mammals resulting from androgen exposure raises the credibility of the hypothesis in accounting for gender differences among human adults. Androgen influences behavior by altering sensitive brain regions, especially around the nuclei and the hypothalamus and the corpus callosum. Udry, Morris, and Kovenik point out that fetal androgen levels and the resultant hormonal effects on brain structure, especially left-right cerebral asymmetry, cause variations in the male and the female brain, which affect cognitive and motor skills, as well as health parameters. Movement and coordination assessments at 6, 12, and 18 weeks support female advantage in fine motor skills and male advantage in gross motor activity as documented by Alexander and Wilcox. Neonatal girls are also more sensitive to pain as measured through facial expressions following exposure to pricks. Transient evoked photoacoustic emissions, sounds produced in the inner ear in response to acoustic stimuli, are weaker in males than in females, mostly in infants. Testosterone levels are heritable in the feminine line, and as such, fetal and adult hormonal levels could be traced back to genetics.